Good morning, my name is Dana Germana. I am doing a presentation on cellulitis for medical terminology 4610, Dr. Halpin. Cellulitis is a serious bacterial skin infection. The signs and symptoms include redness of the skin, warm to touch areas, swollen, painful, tender to touch, irritated areas that tend to extend. More signs and symptoms: irritated areas of skin, blisters, fever can be present, chills, skin dimpling, and a serious cellulitis could result in sepsis, which is a bacterial infection of the bloodstream. Risk factors: any person with an injury or cut, a weakened immune system, any person with a skin condition such as eczema or shingles, lymphedema, a cellulitis history, somebody overweight or has a history of obesity, any person with a break in the skin. Prognosis of cellulitis is good if it's treated quickly. Patients need oral or intravenous antibiotics. If untreated, patients are at risk for developing sepsis, necrosis, which is tissue death, osteomyelitis, which is a bone infection, amputation, toxic shock syndrome, lymphedema, endocarditis, which is a bacterial infection of the heart valve, and death. Diagnosis would consist of going to see your doctor, and they can do a visual exam. They also may include cultures, blood cultures, to rule out sepsis, CAT scan, x-rays, CBC, or complete blood count. Treatment would consist of a physician prescribing oral antibiotics for a full course of 5 to 10 days. If the cellulitis is not improving within the third day, hospitalization may be required, especially if cellulitis also has, the patient also develops a high fever. Treatment in the hospital would be intravenous antibiotics. Typically, they're prescribed for 2 weeks. A midline or a PICC line, which are special longer IV catheters that are used for long-term antibiotics, would be inserted. If an abscess develops, the patient will make a small incision and drain the abscess. Support systems: patients with intravenous antibiotics will need a visiting nurse if they go home to administer and help with medication. Patients may opt to have intravenous infusions at an infusion center, so who is driving them and maintaining the IV, whatever, if it's a midline or a PICC line. Patients may need more advanced care, and they may not be safe to discharge home, so they could go to a short-term rehabilitation facility. Prevention of cellulitis is practice good hygiene, clean any wounds with soap and water, wear proper fitting sturdy shoes, avoid walking barefoot. And that is the presentation. I hope you enjoyed it and learned something today. Have a nice day.